I'm really looking forward to the weekend. And hey, next weekend we have Halloween. Am I right? If you are listening on the K4CO radio mobile app or the website, do know that you can transfer over to our social media platforms. For this, we are breaking in for a very special interview, something that's not really talked about. And a lot of times people think they understand it. They don't really understand it. So move over to our social media platforms. If you do have a question or anything, you can type those into the comments. And this is on Facebook, LinkedIn, YouTube, Instagram. Type in a question and my producer Sabino will bring that over to me. So without further ado, ladies and gentlemen, we're sitting here with Joel Ebel. Joel Ebel is a owner, licensed sales agent, Medicare broker. He's the owner of Answers for Medicare, and you can go to www.answersformedicare.com. Also, phone number for the people listening audio. If you are watching, you will see that on the screen. But if you're listening audio, 303-435-9167. How's it going, Joel?
It's good, man. You make my website sound super cool when you read it in the voice, man. I love
Thank you. Gotta have that radio voice, right? You know, the ups and downs.
Sounds great.
Joel and I were just sitting here talking about all the fun stuff of the old days, the 90s and concerts and sneaking into concerts, all that fun stuff. So, it was good times. It was
a great time of life, man.
Both of us are Colorado natives.
Yeah.
So I don't run into that often. So, I'm looking forward to this one.
Yeah, be good.
Well, I got to tell you to start out, because we've had some health insurance people in before, and they say, open enrollment starts November 1st. And but when it comes to Medicare enrollment, that started last week.
Yep.
So what's the difference there between that? Is it just really the marketplaces that you're going with?
Yeah, it's really about the demographic of the people. So for most people in their employer plan, or if they have an individual plan, November 1st tends to be that time of year where they can make changes. But the October 15th, that's specifically for people that are on Medicare.
Okay.
So, so it's a totally different set of people. Their times are really close. In fact, if you're on Medicare, but you get like a state or like a Paracare, Para does like the state retirement. Mm-hmm. Theirs is actually November 1st. So makes it a little more confusing, doesn't it? But there's some people that applies to both.
Can it just be the same all over the board?
It'd be so much easier if it was.
So when it comes to a Medicare what is a Medicare broker? As opposed, because I think a lot of people can understand regular health insurance brokers, because there's so many different types out there. Mm-hmm. And Medicare, there's a lot of types, but it's all kind of funded from the same source. So what is the big difference with Medicare broker?
Yeah. So, I mean, at its core, it's the same thing. We help people shop and find plans that work for their needs when they're on Medicare. Mm-hmm. The biggest difference is, and I tell people this all the time, and no offense to insurance brokers for non-Medicare, they work very hard. But for most people, you work your job for 40 years, and every year they send you a piece of paper, and it's got 3 columns on it, and it's plan 1, plan 2, and plan 3, and you just pick one.
Right.
And it works, whatever. Low deductible, middle deductible, high deductible, whatever.
Exactly. Do you want to pay more now or pay more later?
Yeah. Well, then you go on Medicare, and they're like, good luck. That's it. Mm-hmm. There's nothing out there. And so it's not just finding the plans that a Medicare broker does. A large part of what I do is like educating people on how Medicare works. Medicare's got all these letters, Part A, Part B, Part C, Part D, and then it's like alphabet soup. And so really it's about educating people and helping them learn how Medicare works, and then finding a plan that's going to work for them.
Gotcha.
And so that's kind of the two-sided piece that it takes to be a Medicare broker.
And I take it with Medicare starting a week ago. I mean, the shutdown hasn't affected it. People can still enroll.
Yeah, because technically Medicare's, what's the word for it? It's by law. It has to work. It has to be working. It has to be continue. It won't be shut down. Right. So that stuff works. And then specifically this window is just for people that are already on it to make a change, which we'll talk about and all that stuff. So, so there is some impacts of the government shutdown as far just because it's hard to be part of the government even if you're still running. It's hard to be running fluidly if parts are shut down.
Right, exactly. Does someone, I've always wondered this, does someone actually need to sign up for Medicare once they hit the age?
Not necessarily.
Okay.
So Medicare does have some rules about what you can do if you're going to work past 65. The term they use is creditable. They want somebody to have what they deem creditable coverage after they turn 65. Usually that number is like, the question we ask is, does your plan cover 20 people? And then there is an element of like how much prescription drug costs the plan covers and things like that. But primarily it's just that 20, does the plan cover 20 people part? And if it does, you can continue to stay on an employer plan as long as you want. Just whenever you do decide to get on Medicare, there's one extra document you fill out that says, yeah, I've been covered since I was 65, and here's the info about it. So,
Gotcha.
So you don't have to sign up when you're 65, but you got to make sure you know that it's going to work. Otherwise, you'll pay some pretty stiff penalties later on.
You will?
Yeah. So they got some late enrollment penalties. Again, this is what I tell people, even if you're pretty sure you're working till you're 70 or 75, like, let's talk when you're 64 and a half, so you know what it looks like, so there's no mistakes, no penalties down the road.
Right. And what would you say are kind of some of the biggest differences between Medicare and the health insurance system that people are surprised with, people learn right away when they're transferring over, adding Medicare? Because a lot of people can keep their health coverage and then just add Medicare to it.
Yeah, they can. They usually don't, just because the costs associated with it. Like if they're paying $300-400 a month with an employer plan, you can add Part A, which is just the hospital side. There's no premium for it for most people. But if you're going to switch to Medicare, now you're double covered. You might as well pick one because you're paying the money for it. I mean, the biggest difference, I think, is, again, people have a very cursory knowledge of their health insurance after 40 years on the job because they really only know like the deductibles or some of the copays. And then all of a sudden you get to Medicare and you kind of got to learn the whole thing.
Okay.
So that's really about the only difference. As far as like the functionality of it, it works pretty much the same as it did before. It's just now you have to get on a new plan and deal with some new timing and some new enrollment dates and things like that.
Are there certain things that people common mistakes that people make when it comes to Medicare that they overlooked? I mean, you mentioned the late payment type, enrollment type stuff.
Yep.
Are there any other kind of like surprises that are kind of common?
There are some. I mean, I think some of it's like really small stuff. Like I think the number one biggest myth about Medicare is, and this isn't even like a retirement thing, this is like later on, people think that Medicare is going to cover like their long-term care costs. That they're like, oh, well, if I can't live in my house anymore, I'll just move to a facility and Medicare will cover all the costs. And that part's absolutely not true. It's still your health insurance, but like the room and board part, the $5,000 a month to live in, you know, whatever facility you're moving to, Medicare doesn't cover that part. I think the other biggest thing for people is, just the timing of it, and when they have to sign up, what they have to sign up for, things like that. That's really, and then common mistakes, just not having a plan. That's probably the biggest single mistake a person can make, is not knowing what the timeline looks like, whether they're going on at 65 or whether they're going on at 70 or whatever.
Right. Which is probably why someone wants someone like you. Yeah. Because, you know, everybody has seen those commercials where it's just like, call and speak to somebody right now.
Oh, please don't.
Please don't.
Please don't call those numbers. I mean, heed their warnings. Don't call them.
Don't call them. Exactly. So why then? Why you? What puts you apart? What separates you?
Yeah. So instead of just being a guy at a 800 number that, you know, you're trying to just see what, you know, magical benefits may or may not be the best for you, for your plan, whatever, you get somebody that knows the plans in our area, knows the hospital networks in our area, knows how to navigate all those things. And then since I'm an independent broker, you're getting my unbiased opinion. So you're not going to call me, you know, when you call those numbers, they're usually representing one carrier.
Okay.
One insurance company.
Gotcha.
So they're just going to be like, no, this is, and we're not supposed to even use words like best, but I bet they use the words like best. Oh, this is the best plan for you. You definitely should sign up for it. And they'll really make you feel like you got to do it now, or you're going to miss your window, or you're not going to get the benefits. And that's not that great.
So when really they should be using, this plan's
Yeah, right. I mean, this could be. It's better for me than it is for you.
Right.
Yeah. So working with me as a local independent broker, you get my unbiased opinion. I know the market here. So if somebody comes to me and says, oh, I use such and such hospital or whatever, I know exactly which plans are going to work for you or not work for you based on hospital or the doctor or whatever, things kind of like that.
So when it comes to plans and local and everything like that, so you can work with people just in Colorado. You can work outside of Colorado.
So I can. I'm licensed in a couple different states.
Okay.
But the vast majority of what I do is here in Colorado.
Right.
So I have most of those states. It's actually been clients have moved, and they've been like, "Hey, I'm moving to Utah. Can you help me if I move to Utah?" Yeah. So I had licenses and carriers, and I go to Utah and help them that way. But everything I do really is here in Colorado.
Do you find that Medicare coverage and plans kind of change dramatically between states or no?
Yeah, it can, because there are certain rules that the plans have to follow that are set by Medicare. But like with Medicare Advantage plans, they can set the prices any way they want, like on the copays,
individual
on the premiums.
States can.
Yeah, okay. Then the plans can. So it can. Yeah. So sometimes people will move and they're used to a copay that's maybe like $10 here, and they move to a state and they can't find it for anything less than $40, and it's like,
right.
Yeah, unfortunately, that's just what it is, because the plans set the numbers for their plans, and so you can't really. So we try, and we usually can, but every once in a while something weird like that happens where. The costs, though, within Medicare are standardized. So, like the premium for Part B, which is all the hospital, or not, sorry, that's all the inpatient stuff. Inpatient, physicians, ambulance, all that. That's standard across every state. Okay. So everybody pays the same for that. It's just their individual plans. They'll see differences in costs.
Gotcha. All right. For those of you just joining, we're speaking with Joel Ebel. Joel Ebel is the owner of Answers for Medicare, licensed sales agent and Medicare broker. Enrollment started last week, October 15th, and it's still going. It can't shut down, doesn't affect this thing. So call out 303-435-9167 if you do have any questions. And you're watching, if you're listening on the app, or through the website, k4coradio.com. You can contact us or just message us straight there. If you're watching on our social media platforms, you can comment with a question. My producer just notified me of a question that we do have on social media platforms. So this one, for those that have disabilities or other health issues, can they also get Medicare even if they aren't 65 years old?
Yes, they can. So once somebody's been on Social Security disability for 24 months, they actually will be automatically enrolled in Medicare Part A and Part B. So normally when I do the class, I'm like 98, this is the unofficial number, but 97% of people that are on Medicare are over 65, but there is that percentage of people that can get on it before 65 through Social Security disability. The other one, I don't know how they come up with these things, but like if you get diagnosed with Lou Gehrig's disease, you're automatically enrolled in Medicare.
Just automatically?
Automatically. Doesn't matter your age.
Okay,
so,
gotcha.
Yep. So Social Security disability does let you get onto Medicare before 65.
And I take it, if somebody has questions as to what disabilities are qualified, they just call you. They just email you.
Well, no. So in that case, that's a specific to Social Security thing. So,
okay.
All of Medicare. So if like there were umbrellas, like Social Security is this umbrella, and then under that one is Medicare. So as far as what qualifies, I probably can get the answer, but probably the best resource for that would be to call Social Security directly and find out what qualifies for SSDI. Is the short term of it.
And does a client pay you directly for your services?
Yeah. Great question. They do not. So like any other insurance agent, I get paid by the insurance company that you sign up with. Okay. So, and even those commissions are standardized. So I really don't have any reason to say, no, that one's okay for you, but this one's way better. Secretly, it's going to pay me double. Like that's not a thing.
Right.
So they all pay the same standard premiums, commissions. So when I say I'm unbiased, I'm truly unbiased.
No reason for you to do anything but inform and get to know somebody.
Yeah, exactly. I mean, and if I do my job right, we review with our clients every single year. I have like a retention. So every year during this annual enrollment, people review their plans, and I make my clients do it. And I have a retention rate of over 90% with my clients. And if I do my job, that review every year is pretty simple because we've already done the legwork of checking doctors, checking prescriptions. And unless something out of our control happens with a big change, they can typically stay in the same plan for the next year. But we still meet, we still talk. figure it out.
And I'm curious about that. You said big changes. Do you find, are there a lot of, I don't know, and I don't think a lot of people know unless you're actually in the Medicare system. Are there a lot of changes every year that occur in the Medicare system?
There didn't used to be. When I started 8 years ago, it was pretty
steady,
steady, pretty flat. Premiums change a little bit here and there. The last couple
just
of
minor
years,
fluctuations.
Yeah, just little stuff. But the last couple of years has been a little bit more. For example, this year, 2025, they implemented a rule. They capped prescription drug costs for seniors for Medicare beneficiaries at $2,000. So that was a huge change because it used to be they had the donut hole. I'm sure you've heard people talk about being stuck in the donut hole with their prescription costs.
I have not. What is that?
So basically, plans used to be structured where they might have a deductible, and then the next step you paid like your copays, $5, $10, whatever it was, until your costs and the insurance company's costs reached a certain number. Say like $4,000, something like that. Once the cost of those drugs reach $4,000, you reach the donut hole. Officially, it's called the coverage gap, but the donut hole sounds better, I guess. People hated it, so I don't know why they named it after donuts. But but it was that. So when you get to the donut hole, instead of paying the $5 copay, you might pay 25%. So that went into effect this year. That's a pretty major change. That'll stick around for next year. And then just the way the market is, we're seeing a little more volatility when it comes to just some of the different plans. Some major carriers are pulling plans out of Colorado right now, which doesn't happen super often for the big guys.
Right.
But yeah, that happened this year. A couple PPOs got pulled. So, and unfortunately, people get a letter called an annual notice of change, and nobody reads it.
Exactly.
Which I get it because it's this thick. Right. It's insurance jargon. Nobody's going to read it. I don't blame them for it.
It's kind of like a bill from, that's trying to pass where it's just like, it's the size of a quarter of the Bible. So
yeah, I'm not reading this. Yeah, absolutely. So some people might not even be aware. But we're starting to see that more plans move in and out of states, be replaced, things like that, more than we used to 7-8 years ago. Gotcha.
And so with this cap now, basically everything's covered after this cap?
It's not, yes. If it's covered by the plan, yeah, your costs are capped. Next year, 2026, it'll be $2,100. But yeah, once you hit that amount, it's completely covered after that.
So that's good.
Yeah, it's good. Yeah, definitely a good thing.
What do people need to do during the enrollment period? Because I'm sure there's a lot of people who just want to take it on themselves and do this, and then there's other people who just want to call someone like you. So, I mean, what do they need to do during this enrollment period when it comes to you? So, just give you a call?
Yeah, so the best thing to do, you can either give me a call. You can also go to our Facebook page, is facebook.com/answers for Medicare. Send us a message. I usually just send people my calendar. That's the easiest way because there's so many things on my calendar. So find a time that works for you.
Right.
And then, we just set up a review. I'll find out what you currently have, what you like, what you don't like about your current plan. And if it ends up that we check your doctors, check your drug costs, all that stuff, and the plan you're in is going to be the one that you like the most for next year, then technically I've done my job. Right. So and that's fine, right? So sometimes people will say like, well, thanks for the help. I guess I'm not switching. So what do you do about money? I don't. And it's fine. Zig Ziglar said you get everything you want in life as long as you help enough other people get everything they want in life.
Right.
So I'm cool with that.
I like it.
Like if that was a poster, I'd put it up in the office.
Right.
So.
Okay.
Yep.
When is the cutoff for enrollment? When do people have to make all these changes or sign up?
Yeah. So December 7th.
Okay, so, December 7th.
Yep. So if you have a Medicare Advantage plan or a prescription drug plan, your opportunity to make that change ends at midnight on December 7th, which is a Sunday this year. So I might be working a Sunday this year.
Might
we'll
be.
Have to see.
During a Broncos game.
During a Broncos game. Yeah. Well, hopefully they're still competitive at that point. So man. I feel bad about it.
Well, hey, we have luck and miracles on our side right now. That last game.
That game was crazy.
We do have another question from social media here. What are some of the biggest reasons to switch to Medicare? Cost and other reasons. Are there reasons not to switch?
Yeah, so for a lot of people, if you go all the way back to the beginning when they're turning 65, for a lot of people, they can save on the premiums. I remember one of the very first clients I ever quoted, I think I did all the math on the Medicare premium, a Medicare supplement premium, and a drug plan, and it was like $300. And I remember thinking to myself, this guy's never going to take this. He's never going to do it. And in the worst sales pitch you've ever seen in your life, I wrote all that down, and then I kind of pushed it across the table. And I was like, so what do you think? And he was like, I'll take it. And I said, you will? Which, again, worst follow-up question. But what I found out...
Sure?
For real about this? But what I found out is he was paying like $1,200 a month through his employer. Yeah, so
through an employer plan?
Through an employer plan, yeah. Because it gets just the most expensive on employer plans. So going all the way back to that, like a reason people would switch is you can get some pretty good savings just on the premium going with Medicare from an employer plan. Even if it's a big employer. I know sometimes people think, well, I work for so-and-so and they've got 10 million employees across the country. They must have the best health insurance. And it might not be true.
Right.
So that would be a reason. If the person who's asking is asking about like their specific Medicare plan, if it's a Medicare Advantage plan, a reason to switch is if your doctor's no longer in network, which again this year, a major hospital network kicked out a couple of plans. So if you have a doctor in that network and you have one of those plans with that carrier, you're out.
You're out, right.
So you got to check. If you have a Medicare supplement, those ones work very differently, but those have a higher monthly premium. If somebody's interested in switching those, the number one reason would be you can save premium by switching to a different carrier.
Okay.
So there's always, I shouldn't say there's always, but in a lot of instances, there's ways to save money going on Medicare for most people. And then when you're on Medicare, the reasons to switch would be losing your doctors or doctor networks, or the plan goes away. So that's, again, why we always tell people, just have a chat with us. We can find out in 10 minutes and have a pretty good idea.
And it should be pretty easy to find all the changes. And I wanted to go kind of to the changes again after this question, though. Yeah. But before you said, like long-term care is not covered under Medicare. What are some of the other things that are not covered under Medicare?
Yeah. So, like specifically under Part A and Part B, which is the original Medicare side, that's the part that everybody at minimum has. That's where like prescriptions aren't covered. That's where some of the costs under Part A, Part B aren't covered. So most of your health insurance will be covered under if you have a supplement or you have a Medicare Advantage plan and a drug plan. You'll get most of those things covered. But there are costs inside of Medicare that can still be very expensive. So there are some other options for plan types. But yeah, the biggest thing is the long-term care. And the biggest problem with that is people believe it's true. They believe that, I can move. I don't need long-term care insurance. I can move anytime and Medicare will cover everything.
Right,
and it's just not true, unfortunately.
How about like smaller stuff, like, I don't know, like dental and like vision and everything? That's all still covered?
So you can get that in a Medicare Advantage plan, or at least not all of them, but that's one of the ways to get it. Otherwise, you can just get it as a standalone. There's really no such thing as Medicare Dental. Like, that just does not a thing. There's no real such thing as Medicare Vision.
Right.
So those can be thrown into Medicare Advantage as like additional benefits. But if you need those things, you can go get those separately. So whoever you want, Delta, VSP, whoever.
Right. On the TV, you always see those commercials where it's just like, people don't know this, that Medicare covers this, but call and you have to sign up for it. Is that, and just because I don't know that much about this, is that something that you don't get it unless you sign up for it?
So those commercials, again, they're assuming a couple of different things. They're assuming that people don't know what they have, or they assume people don't actually have some of those additional benefits.
Okay.
So, like, again, most Medicare Advantage plans have some kind of dental coverage.
Okay.
People may or may not know that. But if you don't have that, if you have a Medicare supplement, you probably don't have dental. So then when you see the commercial, they'll say, oh, well, what about, fitness memberships? What about rides? What about a food card? What about all the... And, of course, people are going to be like, oh, yeah, I would love to have those things. They may already have them.
Okay.
So they're kind of making that assumption, and
Right.
that's usually why they get people to call.
So usually it's just a thing just to get someone to call, even though, just for information on that.
Yeah, you're not usually missing out on what the commercial says.
Right. They definitely don't put it that way.
No, they
put it like, oh my gosh, you need to call, otherwise you're
this
not
is
getting
the
any
only
of this.
plan on the entire planet that has these benefits. You
Right.
better call us now because it won't be available in 20 minutes.
Yeah, exactly. Call in 20 minutes and you'll get this pillow too.
Yeah, exactly.
What changes, if any, do you see? You said Medicare has changed over the past couple of years. What changes do you see possibly happen in the future?
Oh man, if I could see into that crystal ball. No, I know. I do think costs will, of course, continue to rise. I do think that the max on the prescription drug costs, I think that's going to stay. And like it doesn't, that was implemented last year by President Biden. I don't think any presidents in the future, either Trump or anybody in the future, is ever just going to get rid of that. Obviously, that number is going to rise this year, 2025. It was 2,000. 2026 is 2,100. So I would expect, but overall, I would expect that to stay.
Just slowly
rise. Yeah, just like the Part B premium, all that stuff. I do think, I don't know, I'm just shooting from the hip. I do think more costs probably will be put on seniors in the future. So their copays will go up, the deductibles will go up, things like that. So, that's it. I think overall Medicare will stay for a while. And I think it'll just the Medicare itself won't change like overall, like foundationally. I think the plans that interact with them, so the Healthcares, the Humanas, all those guys, I think you'll see more changes with their plans, even though Medicare foundationally might not change that much.
Right. Is there like a website or a certain resource? You said, you get these things in the mail and they're just so thick no one reads them. They just become junk mail like most mail these days. Is there a way to be updated on the latest updates for Medicare, the latest changes for Medicare without relying on television and reading those booklets?
Yeah, me.
You. Yeah. All right, there you go.
No, so and I know that sounds like, what a sales guy answer. But no, like it's genuinely true. Like, every year I have to take testing in the summer to prove to Medicare that I know Medicare. And then all the carriers make me re-up and take tests and things like that. So they know that I know their products and things like that. So, and I'm probably way more interesting than a book. I would like to think I am. I got 4 kids, right? I got stuff going on. So I'd like to think that I'm more interesting than whatever the annual notice of change. But yeah, being a resource like that matters a lot to me. And yeah, honestly, reaching out, that's the best way. Because I can, I don't represent every single plan with every single carrier, but I can still get you any info on any plan that you have. So if your doctors are changing or your prescription drug costs are changing or whatever, the best place to go is to a broker.
And I take it you also know quite a few people. If there's something you can't do, you know where to send somebody.
Yeah.
If something like that happens. And yeah, you said, kids. I just wanted to say 4 kids, 10, 8, 5, and 3.
Yeah. I'm so glad I have this much hair.
Dude, yeah. I'd like to know another 10 years. Come on into the K4CO and we'll see how much of that hair is left.
Yeah, it's fleeting fast.
Fleeting fast, exactly. What kind of got you into being a Medicare broker? What kind of led you on that direction?
Yeah, so when our first kid was born, my wife and I decided we wanted to try to avoid the daycare thing. And her job, she was a teacher at the time. Her job was much more stable. She had our insurance and all that kind of stuff. So it was like, you go figure out how to make money. while watching kids at home. And so I actually did financial planning for 2 years with my dad, and it was horrible. I was not good at it. I know there are definitely guys, because I was 27 at the time. I know there are guys that are that age who are amazing financial advisors.
And love it, yeah.
And they love it. Not me.
No. I was in finance, for about 12 years. Loved it so much I had a bottle in my desk the last 2 years. But yeah, no, I'm definitely not that type of person either.
Yeah, so, it wasn't going well. And then, just random things happen in your life. The carpet cleaner came by our office one day, and my dad is an extrovert. Just as much as I am. We're a family of salespeople. My grandpa used to own a car dealership down Broadway. Talk about old school, like an independent car dealership on Broadway. Not a brand name, independent.
Right. There's still a couple of those.
There's a couple,
yeah.
but not as many.
Not as many.
And yeah, he just had a conversation with the carpet cleaner. And the carpet cleaner, they were talking back and forth. And carpet cleaner mentioned that his dad was a Medicare broker. Mm-hmm. And my dad was like, well, my kid's not doing a very good job as a financial advisor. Let's see that. So he gave me a phone number. I called the guy, and within a couple months, I was on my way. And nice. Medicare just made a lot of sense. It was something that I had been in insurance before, not financial, like on the auto and home side. And yeah, Medicare just made a lot of sense, and it just worked really well for me. And obviously, I can help people, and I've been able to help people, and it's been super great.
Right.
So,
for those listening on the radio, again, Joel Ebel, and it's Answers for Medicare. So you can go to answersformedicare.com. That's FOR, not the number 4. 303-435-9167. And for people kind of, all right, when am I going to retire? What's going to happen? I know there's a lot of different circumstances, extenuating circumstances and stuff like that, but what would you say is kind of an average type, what you can expect to be paying once you stop with the work health insurance and venture into the Medicare side?
Yeah. So right now, with Medicare Part B, the standard monthly premium for that side is $185 a month. I'm sure that's going to go up next year. It goes up every year. In fact, the only year it didn't was 2 or 3 years ago. It had the biggest jump. It went from like 148 to 170, and they almost had like a revolution on their hands. So the next year it actually went down.
Oh, okay. Yeah. They actually listened. Okay,
yeah.
Cool.
And then it's gone up ever since. So, like, they got one, but then it just keeps going up. So that's like the standard premium, and then it just depends what you want for coverage. So, Medicare supplement, you can't have a Medicare supplement and a Medicare Advantage. You got to pick one or the other. So with the supplement, it has a monthly premium, but it has limited out-of-pocket costs. Mm-hmm. So some people like that because even though it's not necessarily a max out of pocket, you can still budget for it. You know what your premium's going to be, you know what your limited out of pockets are going to be, and then you just pay for your drugs.
Okay.
Medicare Advantage, a lot of them have no premium, additional premium. Some of them do, some don't. And then you just pay for the services you use. So
pay as you go.
Yep. So if you go see a specialist, it might be $20, might be $40, depending on the plan. You go in the hospital, it might be $300 a day for 5 days, whatever, something like that. So they can move those numbers around. So really it's just what kind of fits for that person, what they anticipate their costs are going to be going forward. Obviously we can't see everything,
right.
You know, but giving people an idea of like, all right, people having an idea of what they think their costs will be, and then which one might be the one that they like the most.
Gotcha.
So
gotcha. And pre-existing conditions.
Yeah.
Stuff.
Good question.
Yeah.
So after the ACA, I don't remember what year it was, but Obamacare, they said no more pre-existing conditions. So with Medicare Part A, Part B, there's no medical underwriting.
Okay.
With Medicare Advantage, there is no medical underwriting either. With Medicare Supplement, there is. And the reason for that is Medicare Supplement is not actually the health insurance. It is the gap coverage. So like within Part A and Part B, there's deductibles, there's co-insurance and things like that. So that's the health insurance. Mm-hmm. When you go into a supplement, you're paying a premium to Humana or United or whoever, so that when those deductibles come up, like you go to the hospital, there's a $1,676 deductible. You go in the hospital, you owe that much. If you have a supplement, it'll pay that for you.
Gotcha.
So the reason they can do medical underwriting is they're not making the determination on whether something's covered. They're basically trying to figure out, are you a risk where we're going to lose money on you, or are we going to make money on you? And so they can say yes or no. Okay. So pre-existing conditions overall don't matter with Medicare. Medical underwriting only applies to supplements, and I should also say it only applies if 6 months has passed since you got on Medicare Part B. So you actually have a window you can get on a supplement without the underwriting.
You do?
Yeah. So there's still like even a caveat even to that.
Okay.
So, so it doesn't really matter where your health's at, especially when you're turning 65 or going on Medicare. If you worked past 65,
right, you
kind of have the free reign of all the options in front of you.
Okay. And is this October 15th? That's when everything started, the open enrollment, all the way through December 7th. Is this the only time you can make changes?
No. So it's primarily the only time.
Okay.
So, and it's the time when most people do. But we have special enrollment periods throughout the year. So if you like have Medicare Advantage, it's like area based. Mm-hmm. So a service area for us is super simple. It's like the Denver Metro. So if you live in Lakewood and you move to Aurora, your plan will still be just fine. But if you go from Lakewood to Fort Collins or to Pueblo, that's a different area. You'd have to get a new plan. You can do that during the year, no problem.
Okay.
With the supplements, you can change those anytime during the year. Those actually have the October 15th, December 7th, technically has no bearing on the supplement. You can switch that anytime during the year.
Okay.
So, and then, people's needs change. Some of my best referral partners are senior living advisors. They literally help people find assisted living facilities to move into. Mm-hmm. Anytime you move into or out of a facility, you can change plan. Okay. So, and that's a really good one to have because obviously when you move into a facility, especially if you're going to skilled nursing or something like that, you're probably not driving.
Right.
So the rounding physician...
You would hope not driving.
Right. The rounding physician coming into the facility might not be in network for the plan you have.
Okay.
So if it's March and they're not in network, feels like you're stuck, but you're not because they have that special enrollment period for moving into or out of a facility. So you can change your plan in the middle of the year if you move to a facility.
Gotcha.
And if you get back out and go home and you want your old plan back, you can do that too.
Say that again?
So if you move out of a facility, let's say you go for 6 months, my dad's not really like this, but I'll use an example. Let's say my dad's not even this old, but let's say my dad's on Medicare and he goes flying down the side of a mountain on a mountain bike and flips over and just absolutely just messes himself up.
Right.
And he has to live in a facility for 6 months. But then he gets better and he can go back home. He could switch back to the plan he had before he went into the facility.
All of that throughout the year. Yeah. So these changes you can pretty much do anytime.
Yeah.
Gotcha.
Yeah.
And so enrollment, what are the big then bullet points for why someone needs to contact you before December 7th?
Yep. So plans are leaving the state. Prescription drug costs change every single year. Doctor networks change every single year. Costs change every single year.
Right.
They might not be substantial, but if it's substantial to you, it's substantial to you.
Exactly. It all depends on the person. Right. If it's changes for you, if it matters.
Yeah. Exactly. So those are, honestly, it's good to know. Like that's probably the number one reason is it's good to know that whatever you have is actually going to work. Because as much as we can change things during the year, there's not that many opportunities to change things during the year. So if you say, I'm making a video, we'll talk about the videos. I'm making a video right now where I explain how nobody reads their annual notice of change, and then January comes around and they call their doctor and they're like, oh yeah, we don't take that plan anymore.
Gotcha.
And now they're stuck.
Right.
Or potentially stuck.
Right.
Or they had a plan and they get kicked out because that plan's leaving the state. And January 1st comes around and they find out they have no plan. Well, now they have no reason to get back into a plan. So they don't have that special enrollment period. So now they're stuck paying higher costs to Part A and Part B, and it can be financially very bad.
Which can also be penalties on that, correct?
Yeah, because if they lose, for example, if a Medicare Advantage plan that has drug coverage leaves, and you go 63 days without drug coverage, that starts the clock on an enrollment penalty.
Exactly.
So it's always good to know. Nobody ever reads it. I get it. I don't judge anybody for not reading it.
No.
it takes an insurance nerd like me to be like, oh, insurance stuff. Yeah, but I get it. Nobody else does that.
Everybody's really excited to read that kind of stuff too.
They definitely are.
I mean, I know, just talking with you, I'm going to, go read all this stuff, so, I mean, I need something really exciting to do tonight.
Yeah.
That's why people call you. You mentioned videos.
Yep.
Tell us about the videos.
Yeah. So, I am who I am. So it comes to marketing and like my background, so I'm a kid who grew up watching Chris Farley and Adam Sandler and David Spade on Saturday Night Live.
Miss you, Chris.
Oh, so great. Yeah. So when I think of like how to tell people these things through a format like a video, like an Instagram reel, it doesn't really work for me to sit behind a desk and just like read it out loud and just... It works great for some people. Again, not me. So just to keep it with who I am as a person, I created my Bronx mom, which is essentially me with a wig and sunglasses on.
All right, wait a second. Say that again.
Yeah, my Bronx mom.
My Bronx mom.
Yeah. I threw on a Marilyn Monroe wig that my wife had for some costume at a Halloween, and I bought some cheap sunglasses, like the real big ones, and a 80s like Golden Girls windbreaker.
Ooh, I love that show.
Oh yeah. So then I just have conversations with myself, between myself and my mom from the Bronx, even though my mom's not actually from the Bronx. But it was fun. Like it just, again, you watch SNL, you watch them create characters. Yeah. You grow up, you create characters.
Right.
So we were talking earlier about what to not do during annual enrollment. So I made a video where I said, hey mom, it's October, so you know what that means. And she cracks a joke back at me, and then I say, listen mom, if you see a commercial and it says all these great benefits and there's an 800 number, you're supposed to, and then I reply, I'm not supposed to call them. Right, exactly. And then if you get a letter in the mail, I should put it in the garbage. That's right mom, put it in the garbage. There you go. Yeah. So I just created this character just because it's a funnier way for me to get this info out. Maybe it's not for everybody, but it's how I work. So
humor always works.
Humor always works.
Yeah.
It's who I am. So again, sitting behind a desk, like this is a great conversation, but I would not make a video where I was like, all right, Daniel,
let's talk about
me
this.
Crossing my hands like this. Yeah, it's just not who I am. So created a character to make these videos. My kids think it's just the funniest thing ever. So they keep asking me, put the glasses on in the middle of the day and talk. So no.
So you do.
So I do. I'm a sucker for it every single time. I will do it. So
where can people see these wonderful videos?
Yeah, so you can get them on all of our social media. I put them on Facebook. I put them on our YouTube, things like that. So just trying to pass along the same info I normally would, but just in a more humorous way that maybe will stick with people a little bit more.
I like it. Yeah, especially stuff like that. People need to be entertained while learning. Otherwise it's just learning.
Yeah.
Right there. So check it out. Answers for Medicare. You have Facebook. You have YouTube, Instagram.
Not Instagram
yet.
We're not quite to that point. I pretty much will just, again, my dad's not quite Medicare age.
Right.
I will just be on all the social medias that my dad is on. He doesn't have Instagram, so I won't get Instagram for anything
No
yet.
Bronx mom on TikTok?
No.
Doing some dancing?
No. The kids are trying. The kids are asking. It's probably going to happen.
Yeah. We haven't pulled that trigger yet either at the radio station. It's like, I don't know. There's always new ones, coming out too, and I don't know about TikTok, but anything else really that you want to get out there? I mean, of course, follow his advice. When the TV says something that you're just like, that's interesting, call this number. Don't call that number. Call Joel here, 303-435-9167. Or go to his website, answersformedicare.com. And when those booklets come in the mail, don't even, unless you're really bored. I mean, some people are really bored, I miss newspapers personally,
we were talking about how life changes, right? Yeah. No more newspapers.
Yeah. But, what else to our listeners and everybody watching that you want to say about what you do and why they should contact you?
Yeah. I mean, I think the biggest thing is you get my help for no cost to you. Right. And so I've got this knowledge that you don't have to go to Medicare.gov and click all the buttons and read all the pages and type in your own prescriptions and figure out if the doctor's right or that plan's right, or if you call the number even on Medicare, Medicare.gov, the person you're talking to might not put you in the plan that you found that you think is the plan that you want.
Because they have their own objectives.
Well, and just lost in communication. I mean, because they have to sell you in the first call.
Right.
Like they got to handle it in the first call. So, so then, I mean, best thing about contacting me is you get somebody who's willing to walk you through the process. I'm not here to just 10-minute phone call and move on with my life. And if I sold you, great. If I didn't, I'd like, no, like this is a partnership. I become your agent once you sign up. So when things happen, which they do, billing gets messed up, coverages get messed up, you got somebody to call.
Right.
So, I mean, I tell people that phone number calls, apologies if you're not a Yankee fan, but but it calls that phone right there. And so people can get a hold of me when they need me. And so you get my help, no cost to you. You get my expertise, no cost to you. And you get an agent who's going to be there for you all year, not just during this window.
Right.
So
there you go. You said it right there. 303-435-9167. Unless you really just love calling 800 numbers. And going through buttons and everything, and then just speaking to somebody who knows where they are. Find somebody here locally, and even after you set up, like you said, if anybody has any questions, they can always reach out to you.
Yep, happy to help anybody. Yep.
Yeah, definitely. Well, Joel, thank you very much for coming on in. Really appreciate it. If you did catch the end of this, do you know that it's going to be on the K4CO radio social media platforms for at least a month? So rewind it, listen to this. There's a plethora, dare I say, of information. And it'll also be on YouTube, basically forever. So reach out. Answers for Medicare.com, 303-435-9167. Owner Joel Ebel. Thank you very much, Joel.
Thank you for having me.
Yeah, no problem. You guys take care. Coming up soon in about 15 minutes, we have the afternoon mix of music on K4CO Radio, playing you, music from the 50s all the way through today, and a third of our rotation is all your local Colorado musicians. Thank you very much for tuning in, and everybody have a great afternoon. Do know at 5:30, we have the wonderful Scotty Allen from Colorado Springs coming on into the station, and he's going to be letting us play some of his unreleased songs here for everybody. So tune in there. Take care, everybody. Having a great afternoon.